So adults quite often are always asking, I thought fluoride or sealants or even orthodontic treatment was just for kids. They don't realize that preventative treatment can be for all ages in dentistry. I think adult patients that are surprised when I mention sealants or fluoride are patients that maybe haven't been to the dentist since they were a child, and that's kind of the last thing that they remember. So they're surprised when they come in years later and we're still offering that despite their age. So, several factors with your everyday routine can make your teeth more vulnerable every time. Diets high in sugar, smoking tobacco, certain medications can cause dry mouth, and just irregular oral health routine, not brushing their teeth every day, flossing, using a good fluoride mouth rinse. Those can all cause your teeth to deteriorate over time, as well as grinding your teeth. So when a patient sat in the chair, I like to look at their chart. So if I see a patient that has a lot of watches that were the doctor is looking at, they're not cavities quite yet, but there's beginning signs. So demineralization, heavy buildup, they could all be cues that they could really benefit from fluoride treatment or even sealants if they have deep grooves in their teeth. A lot of patients have watches because we like to be conservative. Just because there's a tiny spot, we don't want to just go ahead and do a filling or a crown. We are more conservative. So we keep watches on those areas and we tell patients, hey, focus a little bit more on the upper right. You have some staining and some buildup and kind of go from there. You can't necessarily reverse your cavities, but you can keep them at bay so that they're not progressing with the right oral routine, fluoride treatments, cutting back on sugar, medications as well that cause dry mouth can lead to cavities because there's not enough saliva. So when adults feel fine and are not experiencing any pain and they're kind of questioning, well, why do I need this preventative care, this fluoride sealant? I like to let them know that most dental problems start silently. They may not have any pain or sensitivity. So it's more trying to educate them on why it's good to do these preventative treatments that may be extra to them, but can save them a lot. So during conversations with adult patients, I like to explain to them that most of these problems, even though they're not experiencing pain or sensitivity, they start silently. And that by doing preventative treatments, we can keep those problems small and not progress. To start the conversation with adult patients to explain the long-term comfort and cost benefits, I like to figure out what matters most to them. Is it avoiding pain? Is it saving money? What means the most? And then I go from there. I like to explain to patients that a quick preventative treatment today can avoid a much bigger cost and procedure later.